Hi everyone, this is Ruby Blow of Development Counts. It's been a little while since I posted a video related to my blog post, so I'm back at it this week. And I want to talk about something that comes up a fair amount as a counselor who supervises and trains and mentors other counselors. And this is when I run into people who, for lack of better words, prefer to work with children over adults. Well, inherently, there's nothing wrong with that. We all have a preference of what population we want to serve. But the challenge comes in when the fact of the matter is that children have adults that surround them. They have parents, they have grandparents, they have teachers, they have community. They aren't raising themselves. And so in order to work effectively with kids, we have to be able to work with adults, but we also need to be able to have compassion and empathy for those adults. And so this came up in one of my supervision meetings, and I decided to have a dialogue about it from a perspective that I think most people don't really think about, which is, how do you feel about being an adult? Okay? It may seem like a very innocuous question, meaning it seems like a harmless question, but really there's some depth there. Many people are unresolved about not their childhood, but about the responsibilities of adulthood, about the pain of adulthood, about the challenges of it, whether it's providing for oneself or providing for others, or having to take on additional responsibilities, or sometimes feeling scared, angry, alone, upset. Whereas in childhood, there's an expectation that someone's going to take care of it, someone's going to fix it, someone's going to wipe those tears, someone is going to put a bandage on that bruised knee. In adulthood, we have to take care of ourselves. And I'm finding that for some of us helping professionals, and probably others, but I'm thinking about helping professionals, for some of us, that means that we hold other adults to a very high standard. We can become very judgmental about the decisions they make as parents. We often forget that those adults that are right in front of us were once children. So what does it mean for us to care about kids, but not care enough about them to continue to care for them as they move into adulthood, right? And if we ourselves are harboring some thoughts about our own adultness, things that we don't like about it, things that upset us, then we're more likely to project those unresolved issues onto the families and the adults that we treat and that we serve. So what I'm saying is, make peace with adulting, right? This is a phrase that many people are using now, that sometimes they don't feel like adulting. And I can imagine for some folks, sometimes they don't feel like parenting, or sometimes they don't feel like going to work, or they don't feel like doing whatever it is that we have to do as adults. But we need to have empathy for those around us. I'm not impressed by people who prefer animals to human beings, for example. And I'm not saying that we shouldn't care for animals. What I'm saying is, if we can't care for human beings, then what's happening to our humanity? And I also liken the whole, I prefer to work with kids than adults, that's like a really hard line, to those who, women who say, I prefer to have male friends and not female friends. Because essentially what that woman is saying is they don't really like themselves, right? So we have to look deeper, particularly those who are supervisors, those of us who are supporting other clinicians into growing into practice. We need to support people in asking the questions, to have that reflection on why do I believe what I believe? Why do I have an empathy block when it comes to working with adults? And how can I remove that barrier? How can I see them in me? Right? So that's what I'm writing about this week. I'm writing about adulthood, about adulting, about how having compassion for ourselves and having compassion for others can allow us to better serve them. I'm talking about how We need to be able to relate to those parents so we can best serve those kids. And many of their parents, even if we disagree with some of their practices, were children who had unfortunate and difficult and challenging things happen to them. They didn't just spring up into adulthood. We all go through childhood, and if we're lucky, we all progress to adulthood. Okay, take care, everyone. If you don't get my blog post, you can check it out at developmentcounts.com. Comes out every Wednesday morning at 9:30 for those on my email list, or you can go to my website and check it out. Thanks. Bye.